Welcome to this crucial video on symptoms of high glucose. If you care about your health or that of your loved ones, this content is essential for understanding the warning signs of imbalances in blood sugar levels, especially relative to diabetes. Before we continue, we invite you to subscribe to our channel and turn on notifications so you don't miss any important details that we will share here. The importance of this video cannot be underestimated, as high glucose can be a silent problem, often with no visible symptoms. Knowing the warning signs and being aware of them is crucial for early diagnosis and effective management. Watching this video is a significant step for your health and that of your loved ones, as we offer detailed information that can make the difference between a healthy life and potentially serious health complications. So keep watching to learn more about the symptoms of high glucose and why it's so important. 1. Excessive thirst. At headquarters, excessive is a notable manifestation of hyperglycemia. This happens because high blood sugar levels result in increased excretion of fluids by the kidneys, leading to dehydration of the body. As a result, the person feels constant and unquenchable thirst. This body's defense mechanism aims to dilute and eliminate excess glucose, but at the same time, it can cause discomfort and a vicious cycle, as increased fluid intake can lead to more urination, further aggravating dehydration. Therefore, the excessive edema is a crucial sign to look out for, as it may indicate the presence of blood glucose-related problems that require medical attention. 2. Frequent urination. Frequent urination is a significant indicator of imbalances in blood sugar levels. When blood glucose rises, the kidneys work overtime to filter and excrete excess glucose in the urine, leading to increased urine production. This results in frequent trips to the bathroom, including at night, affecting the quality of sleep and quality of life. Frequent urination can be especially worrying as it contributes to dehydration of the body and is often associated with frequent urination and intense thirst. The combination of these two symptoms, along with others such as excessive hunger and fatigue, can be an important indication that blood glucose levels are out of control, requiring a medical evaluation for proper diagnosis and treatment, especially to rule out possible conditions such as diabetes. 3. Excessive hunger. Excessive hunger is a reflection of an imbalance in blood sugar levels. When blood glucose is high, the body's cells may not receive the necessary amount of energy due to the inability of insulin to effectively transport glucose into the cells. As a result, the body signals a constant feeling of hunger, even after meals, in an attempt to obtain more energy. This cycle of persistent hunger can lead to increased calorie intake and, consequently, weight gain if left unchecked. Therefore, the excessive hunger is an important symptom to watch for, especially when accompanied by other indicators of high glucose, and should be evaluated by a healthcare professional to determine the underlying cause and initiate appropriate treatment, often related to diabetes management. 4. Fatigue. Fatigue, excessive tiredness, results from metabolic imbalance caused by increased blood glucose levels. Glucose is the main source of energy for the body's cells, but when blood sugar levels are persistently high, cells may have difficulty absorbing glucose due to insulin resistance or a lack of insulin. As a result, cells do not receive the energy they need to function efficiently, leading to a constant feeling of fatigue and tiredness. This fatigue can be debilitating and affect performance in daily activities. Therefore, chronic fatigue, when associated with other symptoms such as excessive thirst, frequent urination, and intense hunger, should be taken seriously, as it may be indicative of problems related to blood glucose, such as diabetes, and requires medical evaluation for an accurate diagnosis and an appropriate treatment plan. 5. Blurred vision. Blurred vision may be a manifestation of the adverse effects of hyperglycemia on the eyes. High blood glucose levels over time can damage the small blood vessels in the retina, leading to eye problems such as diabetic retinopathy, which can cause blurred or blurry vision. Additionally, hyperglycemia can affect the shape of the ocular lens due to dehydration resulting from frequent urination. These changes can temporarily compromise the quality of vision, making it blurry or distorted. Blurred vision is a symptom that should be taken seriously, as it can be a warning sign of complications arising from diabetes. Therefore, it is critical that anyone experiencing blurred vision, especially when accompanied by other symptoms of high glucose, seek medical attention for proper evaluation and management of their condition. 6. Unexplained weight loss. Unexplained weight loss may seem contradictory, but it is a significant indication of metabolic imbalances associated with hyperglycemia. When blood glucose is chronically high, cells may have difficulty accessing it as an energy source due to insulin resistance or insulin insufficiency. This leads the body to seek alternative energy, resorting to breaking down fat and muscle to meet its energy needs, resulting in unintended weight loss. This weight loss can be a worrying sign, and when observed along with other symptoms such as intense hunger, excessive thirst, and fatigue, it can indicate the presence of an underlying medical condition, such as diabetes, which requires immediate medical evaluation for appropriate diagnosis and treatment, in order to avoid more serious complications. 7. Recurrent infections. Susceptibility to recurrent infections is related to the impairment of the immune system due to chronic hyperglycemia. High blood glucose levels can impair the immune system's ability to effectively fight infections. Excess sugar in the blood creates a favorable environment for the growth of bacteria and fungi, increasing the risk of frequent infections such as urinary, skin, and yeast infections. Furthermore, high glucose can affect blood circulation, making it difficult for immune system cells to reach sites of infection. Therefore, susceptibility to recurrent infections, when associated with other symptoms of high glucose, is an important sign that blood sugar levels are out of control and should be evaluated by a healthcare professional to determine the underlying cause and initiate appropriate treatment, often related to diabetes management. In summary, symptoms of high glucose are crucial indicators of imbalances in blood sugar levels and can serve as important warnings of health problems, particularly diabetes. Excessive thirst, frequent urination, intense hunger, fatigue, blurred vision, unintentional weight loss, and susceptibility to recurring infections are signs that should not be ignored. However, it is vital to highlight that these symptoms can vary between people and are not definitive diagnoses. Therefore, anyone experiencing these symptoms, especially persistently or together, should seek appropriate medical evaluation. The concepts discussed in this video are critical to raising awareness about the signs of high glucose, but only a healthcare professional can provide an accurate diagnosis and personalized treatment plan. Do not underestimate the importance of seeing a doctor for individual assessments, as early diagnosis and appropriate treatment are essential to effectively control blood sugar levels and prevent long-term complications. Thank you for taking the time to watch this informative video about the symptoms of high glucose. Sharing this knowledge with friends, family, and colleagues can be a simple but powerful action that can make a difference in someone's life. Share this video so more people can be aware of the warning signs of high glucose and take early action to protect their health. And don't forget to watch the next video that will appear on your screen to continue learning about health and well-being.